5:27. Do you have us ready to go with a little light there?
Yep.
In
Good.
3, 2, 1. Eagle Eye News at 7 continues on Eagle Country 106.3. This week with Dr. Joel Saylor of Town and Country Veterinary Clinic. Going to be talking about tick-borne illnesses. Good morning, Doctor.
Good morning, Chuck. Yeah, actually, May, believe it or not, is Lyme Awareness Month. So I don't know who comes up with these months, but May is Lyme Awareness Month. And that's actually for people. And we always talk about Lyme disease, and Lyme disease gets all the news. But believe it or not, there's quite a few tick-borne illnesses that we get. When we say tick-borne illness, that means those are diseases that you get from tick bites. Okay, so the tick bites you, and you can catch like Lyme disease. There's Rocky Mountain spotted fever, and even though we're not anywhere near the Rocky Mountains, Rocky Mountain spotted fever probably is one of the most commonly diagnosed tick-borne illnesses that we find in our patients when we run full tick screens. There's also anaplasma or Ehrlichia. There's quite a few of them that you have to be cautious about, both for your dog and for yourself. So a lot of times these symptoms are very vague. Okay, and a lot of times they say, well, you're not running a fever, so you don't have a, you probably don't have a tick-borne illness. Well, that's not true. Okay, and like for instance, I mean, when I talk about myself, if I don't feel well, very rarely do I take a temperature. So if you don't take a temperature, do you have a fever? How do you know? It's like, if a tree falls in the forest, so it's really important to pay attention to some of these soft signs. Now, in a dog, you're looking at an animal that a lot of times will have chronic weight loss, but not every time. Now remember, each of these symptoms, not all of them have the same. It depends on where that organism settles in the animal. But weight loss is one that we see, joint pain. It might be lameness that shifts from one leg to the other. You might see changes in the red cell counts. And just overall unthriftiness. We do see a lot of hunting dogs that have a lot of that, and a lot of times the hunters will think, well, I'm just working too hard, maybe I need to change it, and think maybe, okay, well, maybe you do have one of these tick-borne illnesses. Typically for people and dogs, if you have a tick bite and you see a radiating rash that spreads out from that tick bite, you need to be forewarned, because that probably is at least an infection with one of these tick-borne illnesses. So if there's ever any question, first and foremost, if you get a tick on you or on your dog, you want to get it off right away, because contact is important. Okay. Secondly, with your pet, you want to be focusing on tick products that repel, not just kill. It's great to kill the tick, but usually if they're dead, they're embedded. So you want to actually repel the tick, so it does the whole back up, beep, 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 get off the dog. Okay, and then of course, if you are suspicious of any of these symptoms, go see your veterinarian as soon as possible.
Absolutely. We'll be back right after this message.